This week on Jersey Matters, as we head into Thanksgiving and the holiday season, should we expect another spike in COVID cases? We asked Dr. Brian Strom, Vice President of Health Affairs at Rutgers University. The hiring crisis hits New Jersey nursing homes. They have open beds, but not enough workers. We'll ask AAA how high gas prices are going to go and if less people are traveling this year. And you'll meet the 12-year-old New Jersey boy who is the youngest chess grandmaster in history. Welcome to Jersey Matters. I'm Larry Menti. Thanksgiving was ruined for a lot of families last year, but this year is different and family gatherings are back. But Dr. Brian Strom, Vice-Chancellor of Biomedical and Health Sciences at Rutgers University, says that will cause another spike in cases. Doctor, thanks so much again for talking with us. We thought of you because the last time I talked to you, you predicted a spike after a holiday. I think it might have been the 4th of July. Are we expecting another spike now with Thanksgiving and the holidays coming up?
Yeah, absolutely. I mean, and in fact, after Halloween, and then it'll be more so after Thanksgiving, but after Halloween, the downward slope of the pandemic has now in the US has stopped. And it's beginning to turn upward again. And even in New Jersey, it's very slowly beginning to turn upward again. So certainly after Thanksgiving, with everybody getting together, with public health measures being relaxed, we certainly will see another surge. And again, after Christmas and so on. But it will never be because, particularly in New Jersey, because we have done so much better in vaccination and much better than much of the rest of the country as well. It'll never be as bad as it was in the past. We're moving to the stage where this pandemic is going to become an endemic instead of pandemic. So it'll be much more like the flu, at least for vaccinated people. Flu always made people sick, killed some people. It was 25 to 50,000 people a year in the US. We tolerate that with flu shots, only being about 50% effective. And yet varies from year to year, and yet only about 50% of people got flu shots. We have much more effective shots now for COVID. For those people who are vaccinated and more recently boosted as needed, their risk of getting COVID is decreased. It's not zero. It is not 100% protective anymore, not with Delta variant. Their risk is definitely less. Their risk of transmitting it to others is less. Again, not zero. So, but the risk of getting very sick from it, hospitalized and dying, is dramatically less. So the key difference is with flu, the death rate from COVID was about 20 times higher than flu. That's not true if you're fully vaccinated. And so we're moving to a state where we will learn to tolerate this and live with this. Part of that is flu happens every winter. This is going to happen every winter. We've moved indoors. We'll be indoors more. We get together for holidays. And like flu, which is beginning now, the winter COVID surge is beginning now. But again, I don't want to leave people the wrong impression. It will not be anywhere close to as bad as it was in prior years.
Well, that's great news, but I guess people should still take some precautions going into the holidays. What can they do?
First piece of advice is get vaccinated. Second piece of advice is get vaccinated. Third piece of advice is get vaccinated. The best thing you can do is be vaccinated. If you're in a group of people who are vaccinated, again, always better to be outdoors, always better to be distanced, always better to be masked. But being with in-person vaccinated people nowadays is really reasonably safe. You're talking about risks from the flu or less. So getting together with family for holidays, I'm certainly doing that. Other people can do that. As long as everybody's vaccinated, it's much safer than it was. There's risk with each person. The larger the number of people, the better. But the typical family gathering, 5 people, 10 people, 20 people, if everybody's vaccinated, shouldn't be a problem. And it just recognize if you then get sick afterwards, get tested for the COVID. It might be you want to be careful about giving it to other people, but your likelihood of ending up in the hospital or dying from it is very, very small if you're vaccinated. Unvaccinated, different story. stay distanced, stay home, or if you're immunosuppressed. But for the normal person, this should be much, much closer to a normal holiday.
So your recommendation would be, if you're not vaccinated, don't put the rest of your family at risk.
Or yourself, because you're at risk from them. I think the recommendation is, you're not vaccinated, get vaccinated. Because otherwise you're at risk, at serious risk, and you're at risk even from your other family members who are vaccinated. So vaccination reduces the risk of transmitting it to other people, but not to zero. And so if you're not vaccinated and hang out with people who are, even if they're vaccinated, even if they're not symptomatic, you still may get the disease from them. And
I understand.
And the disease is going to be getting more common over the next few weeks and few months as we go indoors.
You hear a lot of reasons for not getting the vaccination from people who are unvaccinated. And the one that seems to have at least a little bit of credibility is the fact that they've had COVID and that they feel like they have the antibodies and they have some immunity. Is that true?
It's certainly true that people feel that way. It's certainly true that people who've had COVID have some antibodies. But it's been well shown now that the vaccine gives better protection and longer lasting protection. And even people who've had COVID should get the COVID vaccine, because it will broaden their protection to other variants, and the protection lasts longer than it does after native COVID.
The strongest influencers would be family. And so now we're having these family gatherings, and there'd be some people going to these family gatherings who may not be vaccinated. I know it's not great holiday conversation, but what would you say to someone who's unvaccinated to try to change their mind?
I'd say, don't come to my family event, because I don't want to take the risk of giving you the disease, because you're at risk of being severe, getting severely ill.
That's great advice. Now, I wanted to change topics a little bit and talk about the booster shot. Should everybody be getting it?
Certainly adults should be getting it. We'll see recommendations this week from FDA and CDC recommending it more broadly. It's already been recommended, again, for people who haven't had it more than 6 months since their prior dose, or people who had J&J first, who are over age 65 or otherwise high risk. This week, we'll see recommendations that are approved going forward, almost surely broadening it to all adults. A number of states have already made that change, even not waiting for CDC and FDA.
There's a lot of people who are concerned about getting their children vaccinated, even with the first vaccine. Are they legitimate concerns?
I think these vaccines are extraordinarily safe. And the best way to protect our children is to vaccinate them. So rather than them going to school, and getting exposed to other people who they can get the disease from, it's much safer to get the vaccine than to get the disease. Fortunately, kids are not affected by this disease as badly as adults, but recently 25% of kids 25% of people hospitalized with the disease has been children. And so this disease certainly affects kids. Delta variant, much worse than earlier. Best way to protect your kids is to get vaccinated. Is it 100% safe? Nothing is 100% safe. Any medication, no matter what you take, any food has some risk. But the best way to protect your children, as well as to protect everybody around your children, is to get them vaccinated.
Pfizer now has a pill that minimizes symptoms. What's your feelings about that?
The Pfizer pill is very exciting development as far as we can tell. Again, people haven't seen the science. This is by press release. It hasn't been reviewed by FDA. It hasn't been approved by FDA. People haven't seen the science yet. But this will be the first treatment, and there will certainly, hopefully, be others that you can give outpatient to people once they get symptoms to prevent the symptoms from getting much worse. So it's analogous to Tamiflu with flu. It's a major helpful development if in fact it's real. But the best approach still is to get vaccinated.
Well, Doctor, you're always a wealth of information. We really appreciate your time. Have a great holiday. Have a great Thanksgiving.
Thank you. You too.
Dr. Brian Strom, Rutgers University. Still to come on Jersey Matters, nursing homes in New Jersey are still having problems, but it's not what you might think. We'll explain next.